Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association. Thank you for joining us today for our monthly series called Pláticas, Latino Wellbeing During COVID-19. NALBA is a nonprofit agency dedicated to the well-being of Latino families and communities across the United States. Our mission is to address the disparities affecting the behavioral health of Latinos. We are excited to continue our monthly Plática series on how Latinos and their families can and do take care of their emotional, physical, and spiritual well-being during COVID-19. NALBA is hosting this Plática in partnership with the National COVID Resiliency Network at Morehouse University. Each month, NALBA, with a host of professional experts in public health, behavioral health, and the field of medicine, share their insights, perspective, and information on taking care of yourself, your family, and your community during the COVID-19 pandemic, and also to help identify what additional resources are available to help. To get us started, here's how today's Plática will work. Our guest speakers and I will have an open conversation about how Latinos can cope and deal with their emotional health and well-being during COVID-19. I already have several questions ready, and we'll get started here in just a moment. But we want to ask our Facebook listening audience to be prepared. Ask questions of our presenters, or if you have some comments you'd like to share, please put them in the chat. And we're looking forward to hearing about any experiences that you've had that we can share with our presenters. Incidentally, interpretation is available to Spanish-speaking participants, and the link will be posted in Facebook momentarily. So let's get started. So let me briefly introduce our guest speakers, and I'd like to start off with Dr. Valerie Romero-Leggott. And Doctora, I can't help but say that when you sent your bio, I realized this. I said, this is just her bio. Could you imagine what her resume and her vita looked like? But all I know is there's just too many good things to say. So I'd just like to highlight for our listening audience a little bit about you, and then I'll do the same for Dr. Orozco and for Dr. Garcia, who we'll introduce here shortly. And so let me share this. This is really significant. I'm just blown away clearly by the leadership role you've played, that you continue to play, the influence you've had in your work here in New Mexico and across the nation. It's just remarkable. So thank you for giving me the honor to read a little bit about your bio. So if I can say this, Dr. Romero-Leggott is a first-generation college native New Mexican Hispana with strong roots in her cultural heritage. She received her Bachelor of Arts degree from Harvard University and her medical degree from the University of New Mexico School of Medicine. Dr. Romero-Leggott has a primary care provider been in the forefront of treating populations who have been burdened by socioeconomic, racial, and ethnic disparities. She presently serves as the Vice Chancellor of the Office for Diversity, Equity, and Inclusion at the UNM Health Sciences office. She's a professor in the Department of Family and Community Medicine. In addition to that, she's also UNM HSC Endowed Professorship in Equity for Health. And I have to keep going here because guess what? She's also the executive director of the combined BA MD degree program, an incredible, unique program that promotes the recruitment and retention of a diverse group of New Mexico high school seniors interested in practicing medicine in New Mexico. So Dr. Romero-Leggott, what can I say? But that's just touching the tip of the iceberg. And so before we start with the questions, I'd like to introduce our other panel members that joined us. And incidentally, what a treat it is to have you both with us here today, Dr. Garcia and Dr. Orozco. What I realize, it's like a family party in a Mexican-American family, right? They invite you over for tamales, and then before you know it, the whole clan shows up, you know? Que suave to be surrounded by this clan is just beyond measure, so thank you. And Dr. Ronald Orozco was born and raised in Santa Fe, New Mexico, my hometown, so I'll try not to show too much bias here, but his family is from Chihuahua, Mexico. As you know, the state of Chihuahua borders the state of New Mexico. He got his undergraduate degree at the University of New Mexico and went on to attend the UNM School of Medicine, where he graduated in May. Dr. Orozco participated in the UNM combined BA MD program that Dr. Romero Leggott has helped manage, lead, and has so rightfully made such incredible strides. He currently is a general surgery resident physician at the University of New Mexico Hospital. His goal is to continue to work in New Mexico as a general surgeon and to continue to provide care para nuestra comunidad. So all I could say is, Dr. Orozco, we're just excited to have you here with us, and what a delight. And now Dr. Erica Garcia, if I can, just let me quickly introduce you. I loved your bio, and I just want to share this with the listening audience because they need to know the jewels that are here amongst us here. Dr. Garcia was born in Mexico City and has lived in the United States since the age of 5. Growing up in Clovis, New Mexico, which you all know is in the eastern part of the state, right? You know where all that is, right? She participated in several of the University of New Mexico Health Sciences Center's Office for Diversity, Equity, and Inclusion in the pipeline programs. So we're going to learn a little bit about that today, including the Undergraduate Health Sciences Enrichment Program and the Clinical Education and Board Prep Program. All I could say is you can see how significant this work is, especially to our physicians who then serve our communities. Dr. Garcia received her undergraduate degree at UNM as a double major in biology and Spanish. She then attended the University of New Mexico School of Medicine from 2003 to 2008 and completed her residency at UNM in family medicine from 2008 to 2011. She worked at the Roosevelt General Hospital in Portales, New Mexico, and now works at the Roosevelt General Hospital in Clovis, also the New Mexico Clinic branch, and she serves as the medical director and head of credentialing. So you could see that we just have this powerhouse of physicians here with us today, and it just does me so much pride to have you here with us today. So kudos to you all, and we're going to get started. So we have an anxious listening audience on live Facebook right now, so we should start our exchange, our plática, our conversation. So we're going to start with Dr. Romero Leggott. So if I can, I'd like to do the following. And then I'll ask each of you the same question. So Dr. Romero Leggott, just again, thank you for being here with us today. I'd like to have you share a little bit about how your career path has led to your current positions in the health profession. If you look at your trajectory, your experience, your history, it's just been a layer and a wealth and a showcase of impact. And as a Latina, the leadership that you've provided is profound. So Dr. Romero Leggott, please go ahead.
Well, Senor Sandoval, that was just so nice of you. And I loved how you talked about the layers and just kind of like, I think that's what our journey is really, you know, so many different layers. And I really appreciate the opportunity to be here with you today and the people who have joining us and listening. And then my just amazing esteemed colleagues who are right there on the front lines. So thank you for having us. But, you know, I think everything I really truly believe just goes back to kind of who we are and where we come from, and really feel like my passion and commitment to improve the health and well-being of communities really did come from the values that my mom and dad instilled in me and my siblings, you know, from very early age. I know, as you mentioned before, I'm a first-generation college student and a native New Mexican Hispana, and very strong roots in my cultural heritage. And that's where I draw my strength. And my mom and dad, Gabe and Virginia Romero, are from northern New Mexico, from Rancho San Cañon in Taos, for those of you from here in New Mexico. But, you know, they graduated from high school. They went straight into the workforce. They got married, and then they had 5 of us kids in 7.5 years. So we are a very close family in many, many ways. But, you know, they worked really hard to make ends meet, and they really instilled in us these values about education and being good to each other and other people, and really doing our best at whatever we did. And one of the things that they really taught and instilled in us is that, you know, we stand on the shoulders of others, right? People who may not have had the opportunities that we have. And that, you know, that really, I think to me, if I think about it all, is like where this begins and like why I really care so much about helping those who are following, right? And opening those doors and keeping them open for those who are coming. And yeah, and for me, this translated a lot into creating and developing these education pipeline programs for students and faculty and staff. But really a lot, my joy and love is really about students and creating these opportunities. But it comes from our values and what we learned early on. So thank you for allowing me to share that.
Well, it's such a fundamental starting point for what our lives will look like, and it comes because of so much of our cultural upbringing, our beliefs, our values, and the work ethic that you mentioned. And clearly, if anyone knows about work ethic, it's you and your colleagues here. And so I'm going to ask Dr. Orozco to also tell us about his career path, because if you think about it, he's already in that front end of that trajectory, right? But there's a lot of other things that led to that, to where he's at today. But he also has this phenomenal future ahead of him. And so, Dr. Orozco, please kind of share with us a little bit about your career trajectory and what's gotten you here and what's in store for you.
Yep, thank you. And thank you, Dr. Romero-Leggott. You know, just hearing what she had to say, I have a similar philosophy. And I think a lot of it, you know, moving forward is, you know, they say, well, I like to say, you know, if you climb the ladder, you leave the ladder there and you help others come up, you know. So we do stand on the shoulders of each other. But, you know, my trajectory, similarly, you know, first generation American, United States citizen. So my family immigrated here from Chihuahua, and for the purpose of giving me and my siblings more opportunity. And I think, you know, that's true of our gente, that we just look for opportunity where we can and we make things work. And it paid off. You know, I first to graduate high school and went on to fortunately be part of the BNGAP program, and had that kind of path set for me. So went on to go to college, first in my family to go to university, and now I'm the first, you know, physician in my family. And it had to do a lot, I believe, with my community and the people in my community that supported me. And fortunately, having people that, you know, cared and saw potential. You know, there's a lot of opportunity everywhere, and especially with our community. And it just takes us, you know, caring for each other and giving each other that push for us to, you know, meet that potential that's there. But, you know, it's been great. And now with the way the future looks, you know, just finishing up my residency, and so I can be a physician for the community, for my community, for our community, right? And that'll come with time. But I'm fortunate to have met people like Dr. Romero-Leggott and other people in my life who pushed me and saw that potential to get me to where I am. And of course, my work ethic comes from two people, from my mom and dad. And, you know, they are the hardest working people I know, and that's why I'm where I'm at. But thank you.
Oh, thank you for sharing that. And yeah, you know, so much credit goes to our parents, ¿verdad? And for you to acknowledge them, they probably take great pride in that. So appreciate you sharing that. And Dr. Garcia, you know, similarly, I think, you know, when you think about what has led you to today, and, you know, those previous experiences, and now you're in your own trajectory of your career, and please share something about that, and let's have folks know a little bit more about you.
Yes, so very similar stories to everyone here. You know, coming here to when I was 5, coming to the U.S., learning English. You know, I wanted to learn it really quick. I wanted to be with everyone else, you know, on top of everything and getting good grades. So that was a big motivation, but it does start with my parents. They absolutely made that big sacrifice to come, and they worked so hard. They never finished high school. My mom went to grade school and my dad went to middle school. That was it. So they knew how important it was to come here, get a better life, finish school, and do something. You know, they would always tell us, make sure that you do something that you are going to improve your future for you and your family, you know, your children, everyone else. And so I'm so blessed that they worked so hard. They would work 2 jobs just so that they could pay my tuition in school. Right now, and going through being a female, going through residency, you know, I had my first child, and I'm also grateful that my husband, Dominic, he's always been there for me, helping me get to where I am now. Even now, working here in Clovis, in a clinic, he's helping me. My children are helping me. Everyone's helping me. And so that community, that support, you know, that's where what we need, especially with these hard times that are here. And so, you know, I think we've all have had similar experiences, but I think the love and support have been the major piece to help us get where we are.
Oh, wow. Yeah, that's so powerful, you know. Actually, one of the questions I'm going to be asking a little bit later has to do with families. So you may help weave some of that back into the conversation we'll have about COVID in the second half of today's program. But I just want to take a moment to ask Dr. Romero-Leggott a little bit about the programs that she's helped develop and oversees and leads, because it's very telling, because not only has she put New Mexico on the map, she's addressing one of the most significant issues in our country, and that is, how do we ensure that medically underserved areas have adequate healthcare practitioners and the physicians who are so critical to the healthcare delivery system in our nation, and particularly for a rural state like New Mexico. The work that she's led to helping get physicians in the workforce and to stay in New Mexico, particularly, right? And so, Dr. Orozco, you got 5 stars already for talking about continuing to stay to practice in New Mexico. So, for the listening audience, you need to write down his name, right? So that when you're looking for his services, it's because he stayed in New Mexico to help us and our families. So, but if I can, Dr. Liggett, see, you've led several innovative programs at the University of New Mexico, but we probably would like to know more about the combined BA MD program. And then I'll ask Erica, Dr. Garcia, about the pipeline programs, and just, you know, what's been so successful about them. You know, there's something that you must take great pride in about them, because, well, Dr. Orozco's here as an example, right? So just, if you will, Dr. Romero-Leggott, please kind of highlight and showcase that work, please.
No, thank you for that opportunity. And what I'm so thrilled about today is, you know, Dr. Orozco having been one of our BA-MD students that I'll talk about, and then Dr. Garcia having been in 3 of the other communities to careers pipeline programs. So yeah, I mean, showing that these are working, and it's all about, for us, it's really about growing our own diverse health workforce, right? Because that's what's so critically important now. Like, if we're going to address the health disparities, especially for our communities of color, we need a diverse workforce that understands the needs of the communities, the strengths of the communities, the language, the cultures, the traditions. So that's what's so special about these programs, and then about these incredible products of those programs, and many other things, right? But in Dr. Orozco and Dr. Garcia. So the BA-MD program really started back in 2006. And, you know, Dr. Roth, our prior Vice Chancellor, you know, had been a dream of his, but really at the end of the day, it's all about improving the health and well-being of our communities. And we were going to do this by diversifying the physician workforce in this case. And at that time, we increased our medical school class from 75 to 103. So we brought in 28 more students into the class through this program. But the things like that the program's based on is, we were thinking, okay, how do we get people, like you said, we're a very rural state, right? We are like almost, I think, a little over 2 million people across 121,000 square miles, right? Very rural. lot, problems with access to healthcare. 32 of our 33 counties are health profession shortage areas. So when you looked at this program, we said, how are we going to make sure that students go back and practice in their communities? Well, we know that if they come from rural communities, they're more likely to go back and practice there. If they're minorities, if they're students of color, minority physicians and health providers provide health care to underserved and minority populations 5 times more likely than their non-minority colleagues, right? So we know if we have our minorities. We know that if you practice primary care and you practice in a community for a little bit and have that experience there, those are all the things that are making you more likely to go back and practice in rural communities. So the whole program is based on that, from the curriculum to the experiences. And our legislature funded this 100%. We went back every year for 8 years to get each year of the program, 4 years undergraduate, 4 years of medical school, paid for, and just incredible generosity and belief in this program and what it could do to change the healthcare for New Mexico. So we now have many of our students, so they'll go in the undergraduate and then they go into the School of Medicine. They're automatically enrolled if they achieve what they're supposed to in the program. And then of course they go off and do their residencies, fellowships, everything they do. And then we want them coming back to serve in New Mexico. So right now, given that we started in 2006, we now have a few cohorts that are back in New Mexico. And some of those, I think we have 37 of those students are back in New Mexico practicing now. 76% of those are practicing in New Mexico, the 37. And then we have 81% of those are practicing alumni in primary care. So we have them in different parts. We have them teaching at the medical school as well. So it's showing the success, and 2/3 of those students are from rural areas, and 2/3 of our students in the program are minority students, a little over 60%. But the best way to really understand and kind of really get a glimpse of like what this program's about is asking Dr. Orozco right now as a student, BAMD student, and now a practicing surgeon. He will be like the best person to even talk about what these programs mean.
Yeah.
Yeah,
well,
I mean,
what a wonderful description. Go ahead, Dr. Orozco, please.
Sorry. No, I think it's a good description, and what it is, it's an opportunity. I think when I was in high school and I looked into the program and I applied, it's one of 28 positions, and you don't know if you're going to get it or not, but they're really looking for people that have potential, and then for the students that are wanting to go back into the community. And I was fortunate to be selected as one of those people. And I think it's an amazing program that not only changed my life, but I'm sure it changed the lives of a lot of the other students that were selected to be part of the program. And it's the experience itself was great, and a lot can be said, about the financial support that you receive, because for my family, for example, my parents wanted me to go to university and go to college, but paying for it was going to be a difficulty, and finding programs and scholarships was essential. And BMD provided that, which was, phenomenal. But you see, you work with these other 28 students throughout undergrad, you go with them, to medical school, you see them go off to residency. And it's amazing to see people you basically grow up with, fulfilling their dream of being physicians and then coming back to their communities in New Mexico. We all have that link that we're from New Mexico, we're New Mexican, and we want to help, our home.
Yeah, it's a powerful story, and especially because, when you, from a policy maker perspective, you're investing into New Mexico's future, right? And as you said it, Dr. Orozco, you feel so fortunate, but there's something to be said about, what you bring to the table, right? Your passion, your commitment, and your particularly interested in serving as a physician is so telling because of the things that you described in terms of family support, this educational assistance support from this program, and here you are today, right? All I could say is what a phenomenal story, and I'd like to segue to Dr. Garcia to learn a little bit about the programs you were involved with that kind of helped you to where you're at today, and how did that happen, and say more about that. So just imagine I'm a high school student. You have to pretend like I'm really young at this point, of course. But point being is, so here I am, an 18-year-old ready to graduate now in May, and you're going to have a conversation with me, right? And so part of that is your experience now can serve as a way to communicate to help inspire the students, right? So tell us a little bit more about your experience with those programs.
So first of all, I'm so glad that the BAMD is something that is available for a lot of students. It wasn't there when I was trying to get into medical school, and I wish it was, but it's a really, really great thing. But what they did have when I was getting out of high school was the programs like the undergraduate health enrichment program that took in minorities and kids that had dreams of being in the healthcare. And so, you know, I was one of the few that got selected to do that. Now, what I would tell high school students about making sure that they take advantage of all the resources that are out there. Talk to the counselors, because it was my high school counselor who came up to me knowing that I wanted to go into medicine, and knowing my situation, knowing my finances, knowing that I was struggling with figuring out everything. So he came up to me and he said, this is something that you may want to, go ahead and apply. And no one else applied for it in our high school. And I said, absolutely. So, and I think now that, that I did, I wish that at that time, other kids could have gotten that experience as well. Other kids could have been exposed to knowing that they could have applied to something like this. So, the outreach is really important to provide that information to everyone. So, the primary thing would be ask your counselor, look around, look at the university that you want to go to and see if they have any programs available, so that you can right away apply and see if you can get help and get in, because, without that program, I wouldn't have been able to continue in the pipeline programs, meeting Dr. Romero-Leggott, meeting other people who really helped me go through everything that I needed to get to where I am right now. With my parents not knowing what to do, and with me either, that support was really good for me to know that, hey, I can go to school, I can go to college, and I don't have to be rich. I don't have to have that money. I can look for that. My parents helped a lot, but at least I can navigate myself and get what I need. And so that's what I did, basically. Going through in college, trying to get all those programs. Then I found out about the clinical education program, where I went to JAL, New Mexico, not to JAL, it was JAL, New Mexico, JAL. And I stayed there for 6 weeks, and I shadowed a primary care provider there. And JAL, New Mexico is like 1,000 people population back then. They might have a little bit more, but I stayed there as rural as you can get. And that's where I knew, I was like, I want to be a primary care physician, especially where I grew up in Clovis. And so when my parents had to go to the doctor, they didn't know how to speak English. So they had to have translators, or one of us would go, me or my siblings. And so providing that language, the Spanish, breaking that barrier here for a lot of the patients is really important. And that's what I saw when I knew that I wanted to come back. I wanted to come back and serve the community. But all those programs really helped me to get where I am. And and I hope that grants and that money is always there for the students. It would be devastating if they don't continue, because we won't have the diversity that we can have in our rural health and in all of the USA.
Yeah, so well said. And you grounded what you said about, because you grew up in, it's Curry County, I think, where Clovis
Curry
is
County.
at. And then there are the southeastern counties. So in New Mexico, it's called the Eastern Plains. In the country, it would be like the Eastern Seaboard, right? You know, it's the other side of the state. But in this case, yeah, your experience, your lived experience has really helped to really ground you in your decision to continue to serve that area and the work that you're now doing. So it's a very powerful connection to your community and the work that you continue to do there. So with all of this being said, I want to segue. Go ahead, Dr. Romero-Leggott. Go ahead, please.
Oh, Senor, you know, a couple points that I just wanted to make about these kind of education pathway programs that we all just so much agree on is just how important it is to start these as early as possible, right? Because it's all about opportunities for kids. And so, you know, the fact that we can start elementary and middle school and high school and kind of keep a whole pipeline going is so important, because a lot of these programs are telling kids, because we have so many first generation college students across this nation and in New Mexico, and it's telling kids and showing them like, these are some of the things that you can be, right? And then you talk to them about academic preparation, and you do that in the programs, and you talk to them about, you know, these opportunities, things that like, we don't know what we don't know, right? And then I think really important to our programs is this fact that we have these, again, we go back to values, right? The foundational values, core values, right? So identity and cultural humility and service learning and, you know, community. And so those things, like, we want our students to continue to value and be proud of their culture and their heritage and their language. And because sometimes, you know, and a lot of times you go in the higher in systems, education and otherwise, and those kind of, you end up acculturating in other ways and you may lose that, right? And it may not be as valued. So we want them to know that they are enriching their educational and work environments wherever they are by holding true to these. So I think that's just a critical part of the program, right, as well. And just again, make the point that we have programs throughout New Mexico, including our Enlace in New Mexico, engaging Latino communities for education, grassroots, family-oriented, but it's all about the communities, right? These are communities, they want opportunities, right, for their youth. So our partners and the educators and the families and, you know, parents and families and businesses and everybody, goes back to community that we keep talking about. Family and community, like, we can't do any of these things without all of these partners and the community. So our appreciation and gratitude to them. Thank you.
Yeah, I so appreciate that, because that's absolutely right. Is now, how do we impart and share this with families who could learn about these programs? And so I'd like to move us to talking about the current situation we're all facing in our nation. And so I'm going to direct this question to Dr. Garcia in large measure, because I think it's an opportunity for us to impart your knowledge, your experience, what we're now seeing happening here in New Mexico, because as our families are now having to adjust to these realities, it's something that people think about daily. And there's the whole range of reactions to that, right? And so I'd like to kind of pick your brain a little bit. And so take this as an opportunity to educate our communities with this live show, but then also as it gets recorded, we're going to replay it. So your information will continue to reach beyond today, right? So we're going to make sure that this information continues to be shared beyond today's session. So my question to you is related to, given that the United States is experiencing COVID-19, this pandemic now probably has taken the lives of over 307,000 Americans, and that number is growing. So because of that, it presses us to be prepared for things that have to yet avail themselves to all of our citizens. So my question is, how has the pandemic itself changed your professional approach, your perceptions, and your reactions to this public health crisis? Because being on the front lines, you see how this is impacting the community, the individuals, but it also impacts you as the healthcare professional. And say a little something more about that. We'd like to give you a context for, telling your story. So go ahead.
So being in a rural clinic, Curry County, the pandemic, the spike didn't come to us until after, like months later. So at the beginning, we would just see it in the bigger cities. And then here it was like, is it real? Is it a true thing? Should we believe in it? Is it a hoax? Is it something that is going to go away? No one really knew. But then right now, with how it is, with it reached everywhere, all over the country, everywhere. So now people are more aware of it and really understand the severity. Well, some do, the severity of what COVID can do to them and their families. Being a provider, I see it every day. I hear about my patients being in the hospital. I hear about some of them dying from it. I hear about, get-togethers that are still happening. And some people are not getting together. Some people are taking the precaution of doing that. But for me in my practice, I am in a separate clinic from the hospital. And so we don't see the patients that actually have COVID here in our clinic. We provide services to people for preventative health. If they want to come here for diabetes, for blood pressure medications, for preventative things like vaccinations. So right now, COVID has overtaken a lot of things, and some people are so fearful of coming into the clinic that we're trying to educate people, hey, you still need to get vaccinated for the flu shot. Like, you still need a pneumonia shot. You still need all this. Kids still need to come in and get their well child checks. That has changed a lot because a lot of people have that fear of coming to a doctor's office. And there's some places that have a higher amount of patients with COVID and that they're actually seeing them. But with my clinic, we've been trying as hard. You could try as hard, but you could still get some patients that you never even knew they had it come in. But with the precautions that we're taking, we're trying to still serve the community. We're still trying to get to them to where, if they do get COVID, hopefully they don't get that sick. Hopefully it doesn't impact them. But in terms of practice here, we have changed. Only one person come in, and if you come in with your child, it has to be the child's appointment. But regulation and policy has changed in that sense as well. But overall, everyone in their own practice has completely been different now with the pandemic.
Yeah, thank you. Well, it shows your adaptability given circumstances that one could have never anticipated. And they happen so quickly, and they happen in ways, as you said, how people perceive coming in for care or how they're reacting to it. So yeah, thank you for sharing that. And so kind of along that same lines, Dr. Orozco, how have you observed how the Latino community, Latinos themselves, are being affected by COVID-19? Because every community reacts differently, right? Because of the way we think and what we believe and what we know. And but what have you observed? Because if you think about your hands on the ground work, you really see people's comments, their reactions, how they're emotionally reacting to this. And what have been some of your observations, Dr. Orozco?
I think, unfortunately, our communities, the Latino community, has been being impacted the hardest by COVID-19, as far as people getting infected and unfortunately people dying from it. And we're seeing that in our own state. I think that as far as the hospital itself, less people are coming in for their appointments, for their checkups. Less people are coming in early enough for, different kinds of disease processes that make them sicker when they do come in. And, our hospital right now, it is full. And it's because we just have a lot of people, that are sick and need our care. But if you know, just looking at the numbers across the country, it's just unfortunate to see that it is our community and people of color predominantly being affected the most. And it goes back to, you know, our health disparities and, you know, the way our community is being affected in the States as far as access to healthcare, access to the hospital. But right now, the pandemic is really bringing to the forefront those issues because it's making us sicker. And so at the hospital, that's what I'm seeing. And, you know, there are patients who need screening for cancer that are waiting a little longer to get that kind of screening and finding their cancers later, which is never good. There are patients, you know, that need to be coming into the hospital for whatever reason and just waiting out of fear, you know, but it's affecting us in a big way, and it's hard to see. It's hard to see.
Thank you for sharing that. Dr. Garcia, if I can, just I'm putting myself in your medical setting in your community, and if I were in the waiting room, what might be some of the messaging I would be hearing, either in a waiting room or in a treatment room, about how I should, as a Latino, be helping to mitigate my family's risk of getting COVID? I mean, what would be the kinds of things you would say, and what would you be sharing with us so that you can help inform me and educate me? Because we place such value on our families, right? When you ask Latinos what's the most important thing in their life, they generally say two things: God and my family, right? And that tells us so much, right, about how people look for help and how they engage with practitioners like yourself. So what would you be saying to someone like me, so that this way I can say, I can show how I'm protecting my family, what I'm doing to provide for their safety and their welfare? Because if I place my family at this level, what might be you saying something to me in case I'm ambivalent or I don't know enough, but you know, you want to inform me about that? What would you be saying to me?
Well, this conversation comes up a lot when I see patients every day. You know, it's I see them for diabetes, but then I also talk about safety and prevention, because that's, you know, everybody needs to get educated on that. You know, basically staying home as much as possible. Don't go to, for the Latinos, we love to get together. We love to, you know, the holidays are coming, birthday parties are coming. Don't do it. Don't do it. If you have a bubble of people that you are seeing on a daily basis or regularly, you know, whether it's just your mom and dad or someone, but not an extended family, keep it to the minimum. Always wash hands, always. Stay 6 feet apart from anyone around you. Always wear your mask. And, you know, go to the store early if you can. Go to places early before there's a lot of people going. And that's what I tell my elderlies. You know, try to go as early as you can so that you're not exposed. And right now, some stores are doing some earlier hours to accommodate our elderly population. You know, for some of the Latinos, the grandma and the abuelitos and abuelitas, you know, they should stay home and somebody else take their grocery, leave it at their door, take it to them, you know, minimize how much they're going to be exposed. I hear from the people that have died here in our community, I hear that they had gone to a birthday party. I hear that they went to a gathering and they took grandma, they took the abuelita, and then they got sick, you know, and some of them are making it. Some are fine. This virus can give you a wide variety of symptoms. It could be no symptoms at all, or you can have, you know, the most severe where you just cannot breathe and you're intubated. And then you're in our rural community, our hospitals are full. And so we have to fly them to Albuquerque or to Arizona. And so if here in Albuquerque, it's too full, it's Arizona. And that's such a long distance. You know, right now you can't even go in and see your family members, but that distance is also putting a lot of stress on the families. So to minimize that stress, to minimize somebody going to the hospital, follow those things. follow all of those CDC guidelines to remain safe, and especially now that the holidays are coming.
Oh, excellent. Well, thank you. I want to do a couple of things here with the time that we do have. Just very quickly, we're all now starting to hear more about the vaccines that are being made available to our state and across the nation. And what we're learning is that there's going to be kind of a sequencing of how this will roll out. So vaccinations are going to play such a significant role in managing this pandemic. And I heard that just a couple of days ago, there was a core of medical staff over at St. Christus St. Vincent's Hospital in Santa Fe, where Dr. Orozco's hometown is, who had taken the vaccine. And what I greatly appreciated about it is they were showing the medical staff getting the vaccinations. And they recently asked the president about his plans for being vaccinated. And then he says, well, I'm going to get vaccinated in the priority order that's being advised to me. And I'm going to do it publicly, right? The point being, he wants people to see that he's taking the vaccine. And so, Dr. Orozco, I want to learn a little bit about kind of your thoughts about how this vaccination process will work in terms of how people will probably turn to you for advice, right? Or Dr. Garcia, and of course, Dr. Romero-Leggott will probably be hearing these conversations in the circles that she's in. But, what can people anticipate, and how would you help people become more informed about being ready to be vaccinated? If you were to ask me, Fred, are you ready to be vaccinated? I would have said, I was ready 9 months ago, right? But everyone's reaction is a little bit different. But how would you approach the Latino community in terms of getting them ready to be vaccinated?
So, I'll start off by saying that I'm scheduled to get my vaccine pretty soon here. So, they're starting with the different tiers, but the first tier is, anyone that's working in the hospital directly with COVID patients or going to be working with COVID patients, and we're getting the vaccine first. And like you said, what I'm seeing as far as my colleagues and everyone else at the hospital is they are making it public and very known that, yes, we're getting the vaccine. Look, here, we're getting it and you guys can see it. And it's necessary. And I just want to say, it's a testament to our scientists that they were able to develop a vaccine, with the technology that's available and the information we had available. And the vaccine is safe. It went through all the rigorous testing, that's necessary. And to the Latino community, it's like to trust the science. All the physicians that I know are going to be getting the vaccine. And eventually, when it goes out to our communities, I recommend everyone go and get the vaccine. But remember, this isn't going to go away in a day. This isn't going to go away with the vaccine. It's not a magic bullet. It's going to reduce the amount that people get sick, but you can still pass it around. So masking is probably going to happen for a while still. That's just the reality of where we are. But you should get a vaccine just like any other vaccine available, just to prevent you from getting sick and needing to go to the hospital. And if you're one of the unlucky people that gets really sick, this is going to help make sure that there's room in the hospital for us to take care of you. So for everyone out there, as far as the Latino community is, I'd say just trust the science and get the vaccine so we can help each other out, because at the end of the day, that's what vaccines are for, is for you and for everyone around you to help you.
Well, and hearing the tone of your voice, your delivery, the value of what you've just said, you certainly would make me feel comfortable knowing that there is value to taking the vaccine, because part of that is, we all have to make those choices. And what's important is that we're regularly making the choices to take care of our family. So speaking of the family, Dr. Romero-Leggott, I want to ask you this question because I have so observed, particularly in Latino communities and certainly here in New Mexico, the role of the moms and the grandmothers as the primary healthcare decision makers in their family are so influential, right? I recently told someone, If you ever want to know what where the kids' vaccination records are, is you would go ask the mom, right? And if you ask the dad would say, well, go ask your mom, right? But the point being is, what is the significant role of the moms and the grandmas in being able to help encourage vaccinations and help people make up their minds about moving forward with vaccinations? What might we learn about how those moms and grandmothers can influence their families in a positive way?
Well, I think that's a great question, and what you're talking about right now is actually one of the best ways that we can get the word out and get trust right in this vaccine, because unfortunately, you know, from historical incidents and trauma in the past, many of our communities of color do not trust government, do not trust the system, right? So it is so important. You have to have trusted members of, now like you're talking about, the mothers and the grandmothers, and trusted members of the community are the ones who have to help us spread the message and to really get this out. And so who better, like you said, are the moms and the grandmas here, and really making sure that we speak to them and we answer those questions, and we have them feel comfortable in how important this is for us, for our families, for their kids, for their grandchildren, for our families, for our communities. I mean, this is, you know, like Dr. Orozco and Dr. Garcia both said, this is not just about us as individuals. This is about us as families, right? As families in the community. So it is critically important. I mean, you hit that right on there in saying that we have to get people who our communities and our families trust to be helping spread this message, both about how we can do social distancing and the importance of the vaccine for all of us. And I know it's hard because, as we all know, like, we do love to get together. Like, we're about hugs and being together and more, and family and food and everybody coming together. But right now we have to think of other ways, and we just have to think about it as we're protecting ourselves and protecting our family, right? Our family and our communities. So thank you for asking that question, because really important.
Dr. Garcia, please go ahead.
2 days ago, and you know, we tried to make it as public as we could at the hospital. So it was just 5 of us. There are there could be side effects, long-term side effects. We just really don't know. What I personally had was a little bit of a headache, and I was sore where I got the injection. Right now, I'm not sore anymore. Take some Tylenol and some ice, and it was good. Now, when you ask that question, you know, about the females and about who are we going to ask to kind of deliver that message, you know, it's us as providers, and it's also, right, today I saw a patient who had been intubated. He's over 60, intubated and stayed in a rehab for many weeks. And I saw him today, miracle, he's doing really great. But I asked him, do you think you're going to get the vaccine? Would you get it if you could? He said, in a heartbeat. I would not want to go through what I just did and put my family through that. Absolutely, I would do it. So the people who have experienced it, or the families who have experienced it, they're going to be a big source of that kind of, you know, hey, go get your vaccine. You really need it. You don't want to die, and you don't want to have a medical bill like the one I just got, and, you know, finances everything for that vaccine that can give you some side effects, but that you can get over. You cannot get over death. And so I think that when you put it that way to patients, you know, depending on where they are in life, you know, some people are going to be more apt to get the vaccine.
Yeah, thank you for sharing that. Well, we have a question that came from one of our audience members, and let me pose the question, and then you all can decide who would like to respond. The question has to do with has enough time been spent on researching the vaccine? So it's an example of someone who wants to know, what went into getting a vaccine available, and that's the front end of that process, right? In terms of the research, the clinical trials. But so our listening audience member, and we have both parents. I see moms, dads, grandparents, grandmas listening in, by the way. So it's great to see folks who are listening live. But that question is really important because part of what happens is, I think as Dr. Orozco said, the science is helping lead the way to be able to do this, because this is one of maybe a new vaccine, but there is a long history of vaccinations in our country. There are so many illnesses that have been eradicated because of vaccines and so on and so forth. So I'll just ask Dr. Orozco, did you want to comment a little bit about this so that our listening audience can kind of hear your perspective on that?
So based on what I understand, I think enough time has been spent because they didn't start from scratch, didn't start from zero. This is a new virus in the sense that we haven't seen this virus infect people, but the family or the type of virus that it is, we had research on that kind of virus before. And so they developed, off of the work that other people had already started doing. And a lot can happen when things are funded well. And I think the emergency of this situation is prompted lots of good funding to good scientists that had the time to, help develop this vaccine. Now, the next step of any, vaccine development is going through clinical trials. And, the crux or basis of that is, they test to see if it's safe with people, and does it do its job. And it went through all that rigorous process before being approved by our Food and Drug Administration. So it was quick in the sense of like, we have a new disease, we need to figure out what to do about it. But it went through all the rigorous, steps needed to get something that's safe for our people,
Thank you for sharing that. Believe our 60 minutes is just about up. So I'm just like saying, I'm so totally fascinated by everything that I'm learning today. And I could just talk to you more and more and share that wealth of information with the listening audience. But I want to just kind of close up with asking each one of you, what you think should be one takeaway that people should get from you today, right? So here we are going to wrap up our session, right? And each of you have shared just a great perspective about, your work as a medical professional and as physicians. You really are so important to our communities in our nation and the well-being of our country that I can't thank you enough. So I'd like you to leave us with a final takeaway for the listening audience. So I'm going to start with Dr. Garcia. And so leave us with a takeaway so that after this session ends, people are going to remember what Dr. Garcia said. So go ahead.
Yeah, I think, there's a lot of misinformation everywhere. And it's really hard for anyone to really know what to believe. And so I really, ask every single person to really listen to their doctors, to read scientific, papers, articles. Don't pay attention to everything that you read on Facebook or on social media, unless you really talk to someone that really understands it and can give you informed, information that can help you make those decisions. Now, it's going to be very important that you stay safe and your family stay safe. And so the best way to do that is the vaccine. I truly believe it. I really want everyone to get vaccinated. I know a lot of my family members will be getting it whenever it's available to them, because we stay on top of the news. We stay on top of what's coming out for research and everything. And so I think that's what I would recommend is, If you have any questions, talk to a professional, you know, someone that you know, your doctor, or, you know, forums like this. This is what it is for education. So that's what I would recommend.
Oh, that's wonderful. Just, you know, thank you so much. You know, I'm going to give some shout outs to people here before we wrap up completely, because there are folks that are listening and watching the show right now, and they're all the way up and down the corridor here. And so it's very telling. So you're actually educating all of us who are watching. So thank you, Dr. Garcia. Dr. Orozco, what's your, what takeaway do you have for us, and before we start to wrap up here?
I think just to be patient. Things will get better. We will be able to get together. We will be able to, you know, see our abuelos, abuelas, tíos, tías, and have, you know, our café con pan. It's going to happen, but we just have to be patient. And in the meantime, do our part, wear a mask, stay home, and keep the community safe. Just be patient.
Paciencia. Well said. I think I developed a little bit more of it this year than I have in previous years. But with that advice, all I could say is it's a reinforcement to and encouragement to practice that patience, because, you know, things just are so much more hopeful today than they were some time back. So I'm going to conclude with our colleague, my esteemed colleague, Dr. Romero-Leggott, with kind of her closing comments and kind of bring us full circle from the time that I asked if she would come on to Facebook Live for this Pláticas. She was so gracious to say yes and invite you all to the tamale party, menos los tamales. But Dr. Romero-Leggott, just if you could bring some closure to us, and then I'll do a couple of shout outs. So go ahead, Dr. Romero-Leggott.
Thank you so much. I think I love the messages that Dr. Garcia and Dr. Orozco gave, and appreciate those so much. And yeah, so much has changed in our lives, right? In this last, like, who would have ever imagined we would be where we are? But I still go back to the things that haven't changed for us, right? I feel like our values and our commitment to each other, right? We go back to familia and comunidad and this hope, right? Yes, there is hope, but this idea that we really are, you know, are in this together as a community, as a family. And I think we start with that, and I feel like we end with that, because I think it's this sense of that that's really going to bring us together and keep us strong and get us through this. You know, the people we work with, that our families, our loved ones, it's all of us together doing this. So thank you for having us today.
Oh, it's wonderful. Thank you. So with the hope and the patience and getting vaccinated, all I can say is that's a powerful message. And I want to give a shout out to Phil, Bill, Evelyn, Virginia, Alicia, Ray, Brianna, Gary, Mike, Federico, Margaret, Betty, and others that have been listening in because they've heard your message. And we're going to end today's session with this great thank you to all of you, and happy holidays. Stay safe, stay warm, be healthy, and you're certainly my heroes and heroines. So thank you for the work that you're doing, for taking care of our families, our communities. And we just want to say that if it weren't for the work that you do, things would be very different for our families. So thank you each for being here today. Y saludos and happy holidays.